Hey, this is Brian Waymeyer with Health Gains Coaching. In a prior video, I talked about how to use an AED, and in this video, I'll talk about how to do CPR on both adults and infants. With that said, CPR is a life-saving skill that can help when somebody goes into cardiac arrest. It could happen to anyone when you're walking around, and every second counts in a medical emergency. This skill can make a difference in a victim living, having brain damage, or dying. CPR is crucial because when a person's heart stops, their brain and vital organs are deprived of oxygen. Without immediate intervention, brain damage can begin within minutes. After about 10 minutes, brain damage becomes increasingly likely and severe, significantly diminishing the chances of survival and a full recovery. Therefore, CPR acts as a vital bridge, maintaining blood flow and oxygen delivery to vital organs until medical professionals can arrive. CPR is about quickly and accurately assessing their condition and taking the appropriate action. Since you're likely not a medical professional, one of the best ways to accurately identify a victim's medical needs is to get 911 on the phone. So we'll go ahead and talk about doing CPR on an adult first and then an infant. If you see somebody collapse or you find somebody who's unconscious, make sure the surrounding area is safe and then check the victim to see if they're responsive and to see signs of normal breathing. Preferably, you're going to want to check for normal breathing by looking, listening, and feeling. So you want to visually check for chest rise and fall. This is a crucial indicator of breathing. And if you place your ear close to the person's mouth and nose, then you could listen for the sound of breathing. And while you're there, you can also feel for breath on the side of your face. If they're unresponsive and not breathing, or breathing abnormally, they need CPR and professional medical attention. Call 911 or have someone nearby call. If you're unsure, call 911 anyways. As far as checking for a pulse has become less recommended as it can be difficult for even a trained professional to locate a pulse. Unresponsiveness and lack of normal breathing can be sufficient to determine if the individual is having cardiac arrest, and taking a lot of time to locate a person's pulse would take away valuable time that could be spent on doing chest compressions. As I said, if they're unresponsive and not breathing or breathing abnormally, they need CPR and professional medical attention. So once you've determined this, you or somebody else needs to call 911 as soon as possible. Once you've determined that they need medical help and it's on the way, you need to begin CPR as soon as possible because every second counts. The victim/patient needs to be on a firm, flat surface. They can't be on a bed, otherwise if you're doing chest compressions, it's not gonna do anything. You kneel beside them. You put the heel of one hand in the center of the chest and lower half of the breastbone. Stack your other hand on top, interlocking the fingers, and you're going to want to keep your arms straight, shoulders over your hands, and then you're going to want to push down hard about 2 inches deep. You need to make sure that the chest fully rises back up before your next compression, and repeat at a rate of about 100 to 120 compressions per minute. The rhythm of the Bee Gees song Staying Alive is often used as a mnemonic to help maintain the recommended CPR compression rate of about 100 to 120 beats per minute. For CPR, it seems that hands-only CPR, that is, compressions only, has become more commonly recommended. Chest compressions are the most important part of CPR as it mimics the heart's pumping blood to maintain blood flow. Unfortunately, I had to perform CPR on an individual when I was a security officer, and although he initially recovered at the hospital, he passed away later, like a couple days or so. When I found him unconscious and I spoke with 911 over the phone, they only recommended chest compressions as he was breathing, though it was abnormal breathing. It seems sometimes hands-only CPR has been recommended as it's easier to communicate the steps to an untrained individual and easier for that person to implement CPR. In researching about this, I've seen that in adults, hands-only CPR has been shown to be as effective as traditional CPR in many cases, largely because the primary need in these situations is to circulate the oxygen that's already present in the bloodstream. But I've also seen that longer periods of cardiac arrest require breaths to be administered with compressions. In addition, I've seen that some people suffer from cardiac arrest because of respiratory problems, with conditions such as COPD, congestive heart failure, drowning, asthma, and substance overdose. It's imperative to provide CPR with proper breath. For children and infants, respiratory problems are often the primary cause of cardiac arrest, so it's always recommended to administer compressions and breaths. If you were to add breaths in for an adult, it would look like this. After providing 30 compressions, you would tilt the head back to make sure the airway is open, lifting the chin, pinch the nose, and give 2 breaths, 1 second each. And you want to make sure that they're forceful enough that they're actually getting air, and you want to watch for the chest to rise. If you could see their chest rise, then you know that they're receiving the breath. If their chest doesn't rise when you're giving breath, then their airway may be obstructed. You may need to carefully reposition their head, or they may be choking on something. You won't put them into the Heimlich position though. Chest compressions are the most important aspect of CPR, and they could potentially dislodge something that's stuck in the throat. After doing your set of compressions, if you see an object in the mouth that you could safely remove, then you may do so. You should just keep in mind that the victim may bite down on your fingers. You also want to make sure that you don't push the object farther down. After giving 2 breaths, then you're just going to repeat the cycle. Do 30 compressions, then give 2 breaths, and then repeat again. And you're going to want to keep going until help arrives, the victim starts responding, or until you physically can't continue anymore. If someone else is with you and properly able to perform CPR, then they could help by administering breaths and or replacing you when you get tired. The more trained people there are at the scene, the easier administering CPR can become. You just don't want to switch who's administering compressions too often, as the patient needs continued compressions as consistently as possible. If you're observing somebody perform CPR, you can take over if they become unable to continue CPR in the proper form, such as no longer being able to deliver compressions to a sufficient depth. For performing CPR on an infant, for a baby under 1 year old, it's kind of similar, but it is a little bit different. Again, you're going to want to make sure your surrounding is safe. You're going to want to check the infant for responsiveness, gently tapping their foot, stroking their arm, but you never want to shake a baby. If they're unconscious, not breathing normally, then you could start CPR and obviously call 911. For infants, I've seen some advice online saying that if there's no one else to call 911, you should perform 2 minutes of CPR first and then call 911 and then continue CPR. At this point, pretty much everyone has a cell phone on them at all times. So if you were by yourself, you should be putting your phone on speakerphone, calling 911 while you're starting CPR at the same time. Again, you're going to want them on a flat, firm surface. And instead of using both your hands, you're just going to use 2 fingers in roughly the same spot, just below the nipple line in the center of the chest. And you're going to want to press down about 1.5 inches. Gentler than adults, but at the same rate of 100 to 120 compressions per minute, making sure that the chest fully rises between compressions. If you're alone, it's 30 compressions and 2 breaths. If you got help, then you could do 15 compressions. The other person can give 2 breaths, and you could repeat that. When you're giving breaths, you want to make sure that you cover their mouth fully with yours and cover their nose. Give 2 gentle puffs, 1 second each, and watch the chest rise. And the same thing holds true. You want to keep going until you physically cannot anymore, or until medical professionals arrive, or until the baby starts to respond. If the baby was choking, you would handle that a little bit differently. According to the Red Cross, if an infant is choking, you want to position them face down along your forearm, using your thigh for support. You want to keep the infant's head lower than their body, and you always want to make sure that you support their head and neck. With the infant facing down, you can give 5 firm back blows, striking between the shoulder blades. After 5 back blows, you can turn the infant face up with their head lower than their body, still supporting their head and neck, and you can give 5 quick chest thrusts about 1.5 inches deep. And then you just keep alternating between back blows and chest thrusts until the infant can cough or cry or becomes unresponsive. If the infant becomes unresponsive, lower them to a firm flat surface and begin CPR, starting with compressions. If you have a child that's older than 1 year but hasn't hit puberty, then CPR would depend mostly upon their size. If they're small, you may use 2 fingers. If they're older or bigger, you may want to use 2 hands. So that's CPR in a nutshell. It's a skill that anyone can learn, and knowing how can help save a life. In the US, Good Samaritan laws protect you if you try to reasonably help and appropriately help in an emergency situation. Just act within your own comfort level and check your state's laws. However, I highly recommend getting certified, taking a certified CPR course, as this video is for informational purposes only and is not a substitute for proper training or basic life support certification. That'll be all for this video about CPR. If you have any comments or want me to talk about a different topic, then let me know in the comments below. Until next time, take care.